Hello, today on a new episode of the 911 podcast, we will talk about what AI gets right and wrong about the health field. Today's topic is about the nurses shortage. You have certainly heard that the nurses shortage is quite important. Many nurses quit bedside for a lot of reasons, and it has a lot of impact in patients' care. In a world where AI keeps evolving, I decided to interact with ChatGPT to examine their answer and see whether it is reliable or not. The first question I asked was, how many new grads quit within the first year? ChatGPT assessed that a study conducted in Eastern Canada surveyed 348 new graduated nurses over a 5-year period from 2004 to 2008. The results showed that 4.9% were planning to leave their current employer and 45.5% expressed different levels of uncertainty about staying. When we read this, we can already see that the answer is outdated. It is from 2008 and we are now in 2025, so it is 17 years old. Between 2008 and 2025, the shortage situation has changed a lot. Becoming a nurse is still hard and we need to study a lot. We also work in team, and many people rely on us because we are the ones who see the patients the most. It is not for everyone. But the pandemic has surely contributed to the worsening of the situation. It caused the retirement of many nurses, and a lot of healthcare professionals decide to change their career path. Since then, the population also got older, so we are less people to take care of a lot of patients. Just by analyzing the pandemic situation, we can understand that the study is outdated and the data has certainly changed. I went on the Google search bar and I asked the same question. I wanted to find other source that was up to date to confirm or invalidate ChatGPT answer. In a study called What Influences New Graduated Registered Nurses' Intention to Leave the Nursing Profession from the National Library of Medicine, it was between 18 and 30% of new grads were quitting within their first year. Imagine how many students we trained for them to quit after a year. One question was not enough to see if ChatGPT was reliable or not, so I decided to ask another one. The second question was, where do nurses go when they leave bedside? First, I think it is important to understand that bedside is also called direct patient care. This is the kind of job that involves working directly face-to-face with sick people and taking care of them when they are hospitalized. Healthcare professionals often find it draining because of their workload and their working conditions. When they are exhausted, they try obtaining other types of nursing job that does not involve working night, weekend, or overtime. ChatGPT came with a long list of options for nurses, such as education and training, administrative and leadership roles, remote and tech-based roles, public health nurse, occupational health nurse, medical writer, legal nurse, nurse practitioner, midwife. Because there is a lot of words, you may think it is complete, but unfortunately it isn't. Although ChatGPT cites a good number of options for nurses, it isn't complete. According to supplemental health care, nurses can also go work in agency, clinics, and nursing homes. Those are options that are not said in ChatGPT answer. That shows it is incomplete. I think it can be reassuring for nurses to know that there are several options for them to go work by where they can maintain a balance between work and family. In conclusion, ChatGPT can't be a reference by itself when we want to do research. It is important to validate the information with other reliable sources. Although AI can be a great tool, we need to analyze its assessment before using it because it is often outdated or incomplete. Make sure that the information you are spreading around is true. It was a pleasure to be with you today. Be there on the next episode where we will talk about cell phones being banned in schools.